To engage children to take part in patient surveys, Alder Children's NHS Foundation Trust has helped develop a tailored questionnaire called the National Paediatric Toolkit. Delivered on Panasonic mobile clinical assistant devices, the solution has proved ideal in providing an easy-to-use, safe and resilient tool for children.
This day and age, patient experience is extremely important, and it has to have, we have as clinicians, whether a nurse or a doctor, a high regard to the patient experience. Because where we're heading in the NHS, one of the most important principles that I suggested in the next stage review is personalised care. You can only do personalised care if you can measure the experience of that patient.
The National Paediatric Toolkit, I think, is a fantastic opportunity to match the expectations, or allow us to match the expectations of the next stage review, the Darcy review. The basis is that was about high quality care for all, and children and young people often get left out of the all. So we owe them a duty to make them included absolutely at the heart of the next stage review.
The solution that we selected was, well, it's the National Paediatric Toolkit, known lovingly to us as Fabio. And we chose this because it's in keeping with what children do these days in terms of technology and electronic solutions. But it's just so easy to use. It gives us a real insight into what children think about the services. It's essentially a piece of software that goes in a tough book, as we call it, which can be thrown, wiped, bit, you name it, anything can happen to it. And the children just feel as if they're literally playing a game. And there are incentives in the solution whereby if they answer a question, then Fabio comes and performs some revolting thing, and that then inspires them to move on to the next question.
There are two major benefits for commissioners. The first is that it delivers them the information that they need for making their own strategic decisions in the way that they need it. The other thing is that they have a tool which is designed by children. We didn't simply put our developers in a back room and tell them to get on with it. It's involved children at all stages of development. So it's designed by children for consulting children.
I like it that it keeps trying to catch his eye and everything keeps him not trying to catch it. He asks us about the hospital and is it clean? Do the staff keep everything private? You just have to touch the button and you have to read the question. Simple.
Fabio is multifaceted. He'll either speak to you or you can touch him and he'll move. He's very, very resourceful. And this allows our children with perhaps very severe complex health needs to be able to communicate through Fabio to us about their experience.
A Panasonic Tough Book's really important. You know, this is a children's environment. They play, they're active, they're moving around. It needs to be fun, it needs to be portable, it needs to be hygienic as well. We need to be able to use it in our intensive care unit, in our community settings. So the Panasonic Tough Book's absolutely ideal for that environment.
Tough Book is exactly what we need for the software. We're very, very conscious of hospital-acquired infections, therefore we needed something that was really cleanable and durable. Children, as children are, may drop it, throw it, stand on it, spill some things on it, so we wanted something that was very durable and portable.
The children said they wanted a tuck shop, and I can't give them a tuck shop, but we've managed to get a couple of vending machines so that they can get things nearer than the shop down the corridor. We've got an animation project because the kids said that they were fed up. So we're hoping that we're introducing things to engage with them and to help them be less fed up. The Teenage Cancer Trust have said that they may support us with an activities coordinator for the older children. So I'm hoping that some of the feedback that the children have given us about being fed up will help persuade them to give us some money to support another member of staff.
I would like to see it used to capture children's views in all sorts of areas, whether that's in health, like in a hospital like this, or in general practice, for example, or in the community. Actually, I think it would work in social care settings as well, children, out there in community. And the other area I think I just wonder about is education, because I know that schools are very keen to capture the views of their pupils from 3 or 4 years upwards, right the way through to about to leave for college. And what better way of actually capturing that information in a fun way and actually helping people, children, to improve their educational experience as well as their health experience.